Now off to our presentation. Now I'd like to welcome back Colette Katuala, who's been providing us with these annual mandated reporter trainings. She comes to us with over 2 decades of experience as a public child welfare professional. She has experience as an emergency response investigator, as a supervisor, and has supported child abuse investigations. She's also supported staff working in court units and has provided coaching and training to new and ongoing child welfare staff. She currently serves as a coordinator of the Bay Area County's Child Abuse Prevention Council. And in addition to her public service career, she has also opened and currently operates Focused Clinical Solutions, a small private practice that supports the community's pursuit of improved emotional health. And she also writes curriculum and trains on various topics impacting children and the well-being of their community. It's a pleasure to have you back, Colette. Now turning it over to you.
Thank you, thank you, Catherine, and thank you all for attending today's training. Again, my name is Colette Katuala, and today we'll be talking about mandated reporter training, but actually having a discussion before we get to mandated reporting. And there was one change. The third part of the series will be actually on May 1st. So that's just one update. The second training is next week, May 22nd or April 22nd. So I will be going through talking about definitions of child abuse, the federal and state definitions. I will be covering the updated California laws regarding poverty and neglect, going over how we can apply our role as community supporter and integrate ways of community pathways of support. About halfway through the training, I will pause and ask any questions if people want to think about possible scenarios or questions they've had in working with families. I'll be able to take a pause and take that. So kind of think about that as we go along with our presentation today. And as we start, if you can, put your name and your role in the chat, and if what would you like to get out of today's training? If there's something specific that you would like to get out or talk about, then feel free to drop those in the chat. As I go with my presentation today, feel free to either unmute yourself or put a question in the chat, and I'll do my best to monitor them and answer those questions as we go along. All right, here we go. So we're here today really because of a federal legislation that was passed in it began to be passed in the mid-70s, and the federal definition, the federal laws of mandated reporter trainings has been updated over time, most recently in 2019. So what did the federal legislation of child abuse reporting, or the Child Abuse Prevention and Treatment Act, or as we call them, CAPTA? It did several things. It provides us with federal funding and guidance to states that support prevention services, assessment, intervention, prosecution, and treatment activities. It also supports research, evaluation, and technical assistance. It also established the Office of Child Abuse Prevention, where most of the child abuse prevention councils are. They provide us with oversight. It also established a national clearinghouse of information relating to child abuse and neglect. And it set forth a federal definition of child abuse and neglect, and which I'll say, which we'll be going over for these 3 trainings. It means at a minimum, any recent act or failure to act on the part of a parent, a caregiver, which results in the serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of harm. Now, before we continue, I want to take some time to really break down the federal definition of child abuse and neglect. And what I like to point out is that the federal definition has 3 points of things that we need to pay attention to as mandated reporters, as community supporters. One of the first things that it says is it is a recent act or a failure to act. A lot of times as mandated reporters, we may forget or not really pay attention to this recent act or failure to act. A lot of times as clinicians or as supportive people in our communities, as mandated reporters, we feel that any information that we receive of past abuse or neglect must be reported. However, that's really only in the case of sexual abuse, because sexual abuse, amongst all of the child abuse categories, sexual abuse is categorically described or is a crime. Not all child abuse, like general neglect, even physical abuse, emotional neglect, those are not crimes. So the reason why sexual abuse falls outside of this definition of recent act or failure to act is because it's a crime. So one of the things that we need to pay attention to is the information that we're receiving a recent act or failure to act. So that's point one. Point two is on the part of a parent or a caregiver. Child welfare intervenes in the lives of families. That means that when we're calling child abuse when we're calling child welfare specifically to report possible abuse or neglect, when we're calling child welfare, that means that we're concerned about the parent or the caregiver. There are situations where children are being harmed or at risk of being harmed, and we're not worried about their parent or caregiver. So then you may ask, well, if I don't call child welfare, who do I call? What do I do? Law enforcement and child welfare receives suspected reports of child abuse. So if you are calling or needing to make a report and you're not worried about the parent, you're not worrying about the caregiver, then you are calling law enforcement to make that suspected report of child abuse and neglect. And so before I move, so that one, so first it's recent act or failure to act. The second is on the part of a parent or a caregiver. And thirdly, the final point is really talks about the types of abuse, and death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of harm. So this act or failure to act, that is what the federal government describes as neglect. That failure to act is neglect, but the neglect has to be something that presents an imminent risk of harm. Now, we'll be talking about neglect statistics specifically in today's training and throughout our series. And the federal government, the state government is really trying to shrink or limit the definition of general neglect specifically. And so it has this caveat of a failure to act which presents an imminent risk of harm. So when we're thinking about neglect and we're thinking about like the families that we work with, since most of the calls that we receive, most of the calls that are investigated across the county, across the state, really fall in this area of general neglect, we have to ask ourselves, is this failure to act or neglect, does this present an imminent risk of harm? And most of the time, it does not. So we do need to have a better understanding of what the definitions of general neglect is specifically, and what do we do if we're not filing a suspected child abuse report, because just because we don't report to child welfare or law enforcement doesn't mean that we're not required or required to do something else. So before I get into the next slide, I just wanted to look to see what people are saying in terms of what they would like to get out of today's training. Some people are looking for some updated guidance regarding mandated reporting laws. Okay, we should be able to cover that. A better understanding of policies and procedures surrounding child abuse and prevention. That's a good one too. We'll be going over that. There has been some guidance that has changed since last year's training, so I will be providing some updates to everyone around that. Um, Interesting about learning California child abuse laws from a different state. Child abuse reporting laws are different from state to state. So this training will cover specifically the laws that are governing here in California. So do make sure that whatever state that you're practicing in, that you're supporting families in, that you are clear about what those states' laws regarding child abuse reporting. Again, we will go over some updated mandated reporting laws. Some new updates, we'll be able to cover that. Another participant is asking about staying informed so they can act in the best interest of children and appropriately meet any obligation that they have to act. Hopefully, I'll be covering that too. Definitely some more mandated reporting updates and how to support families better for child abuse prevention. We'll be going over updates. Love that. All right. So the Child Abuse Prevention and Treatment Act, or as we call it, CAPTA, did have an update called the Comprehensive Addiction and Recovery Act of 2016. This really talked about, stated that the states must have policies and procedures to assess and address victims of sex trafficking specifically. And if you're dealing with families, or if you're working in places where there's a birthing hospital, it also required states to have a plan for infants born and identified as being affected by substance use or withdrawal symptoms to develop plans of safe care to address the treatment needs of the infant and the affected family or caregiver. So what this is saying is that this federal government and state laws are decriminalizing substance use disorders and really working towards not only supporting that child, but supporting families and their extended families to provide care and support without removing children from their home. Every state law, whenever the federal government passes down a law, the state has the obligation to operationalize it for the people within their state. Here in California, it's called the Child Abuse and Neglect Reporting Act, or CANRA. CANRA helped us define or establish what reasonable suspicion is. It also established procedures for reporting. And then it designated here in California certain professionals and volunteers that are required to report. So it really designated and outlined all of the mandated reporters and volunteers here in California that are required to report. I do want to say that is different state over state. There are some states, there are about 9 states in our union, that every adult is a mandated reporter. So we do need to be very clear about what are my reporting responsibilities in the state that I'm working in. So the definition of reasonable suspicion. The definition of reasonable suspicion states that child abuse must be reported when one who is who is a legally mandated reporter has knowledge of or observes a child in their professional capacity or within their scope of their employment who they know or reasonably suspects has been a victim of child abuse or neglect. It goes on to state that reasonable suspicion occurs when an objective person would agree that the mandated reporter has reason by evaluating facts that lead them to believe that a child is at substantial risk of harm or being harmed. Mandated reporters can and should use their particular expertise to evaluate those facts. So one of the things that I want to point out here is that the definition of reasonable suspicion, if you're looking in the second paragraph, it talks about a reasonable suspicion occurs when an objective person would agree that mandated reporter has reason by evaluating facts, would lead them to believe. So reasonable suspicion definition has a built-in piece where you are supposed to consult with a colleague. It has a built-in consultation piece because mandated reporting, determining reasonable suspicion does not happen in a vacuum. It wasn't designed to happen in a vacuum. It really has a built-in law to say, mandated reporter, talk to a colleague, talk to a supervisor, to see if I have these facts and if I share these facts with a colleague, that they would also believe that, yes, those facts they would agree that that child could be a victim of mandated reporting. This is really something that I found has kind of been may have been passed over. We may not have really thought about the core definition of reasonable suspicion, but it is supposed to be done in community, even though mandated reporting is an individual responsibility. It is built in for us to talk to our colleagues about am I being biased? Or when I look at these facts, what do you think? To have someone that you can bounce those ideas off on. Reasonable suspicion goes on to say that it does not require certainty or specific medical indication. And we'll talk more about what that means. And it also states that pregnancy of a minor in and of itself does not constitute a basis for reasonable suspicion of sexual abuse. They did have to put that piece in because as adults, we may and we do have our own values and biases around children having sex, even children getting pregnant. And we may assume, some of us may have assumed in the past, that if a child or a minor is pregnant, that they must have been sexually abused. The reason why a lot of these laws come into fruition is because they see an impact of certain agencies, certain mandated reporters or groups of mandated reporters that may be over-reporting or utilizing child welfare as opposed to using other community supports. And it's a really good way for us to continually check our biases around various things. So reasonable suspicion, though it has a definition that, I just went over, it's still pretty vague. And reasonable suspicion can have both as objective and subjective meaning. A lot of times mandated reporters often use their first suspicion or first discomfort rather than reasonable suspicion. And once first suspicion is reached, the mandated reporter generally considers any further engagement with the family before reporting as investigation rather than information gathering needed to bring their level of concern to reasonable suspicion. So I've seen this a lot, and I've talked to a lot of people really about their worry about possibly investigating once they receive some information. However, a lot of times, once they receive that first suspicion or first discomfort, they're they may not have reached reasonable suspicion, and so that leads to over-reporting that may lead to a rift in your relationship with that family. And we may even lose the opportunity to provide support to families. So we'll talk about how we can really provide support to families and be really clear on the very narrow definition of reasonable suspicion. When we're establishing reasonable suspicion, a lot of times I know when I was first trained as a social worker in child welfare many years ago, I was also trained to quote unquote follow my intuition. Now, looking back when I'm like, follow my intuition, follow your gut feeling, they really didn't talk to me about the utilization of facts to inform that intuition. What I found when people are like, well, I may have this intuition or I have a gut feeling, sometimes that gut feeling could be indigestion. So we really need to make sure that we have facts to inform whatever feelings that we're getting in our gut. Another thing we need to look out for is the worry and impact of poverty. Poverty and general neglect are not the same thing, and a lot of times mandated reporters are reporting on the impact of poverty, and again, maybe missing out on an opportunity to support that family. We also need to ask ourselves, are there good explanations for the situation other than abuse and neglect? This is also in alignment with something called gaze aversion. Gaze aversion is when we may see a situation, we may have some facts, but we may explain it away. We may say, oh, well, that family is a good family. They live in a good neighborhood. They seem like really nice people. And so a lot of times, or sometimes there is a worry that instead of really evaluating facts that are there for possible general neglect, we kind of look away, or we may see something that we're uncomfortable to talk about or discuss, and we may fail to report or engage the family in deeper conversations. Gaze aversion actually, when I was doing some research about this, actually happens more with children who have higher socioeconomic statuses. So people that have like maybe children are going to private schools or live in richer neighborhoods are less likely to be reported than families from low income or middle income families. There's also been some biases or some direction of reporting. Some people have also been trained, when in doubt, report, without really understanding the impact of reporting or the impact of families to families and your relationship. We also need to ask ourselves, whose risks are we contemplating when reporting decisions are made? A lot of reports historically, and when we're looking at research on who are making the reports or why people are making the reports, a lot of times mandated reporters are making a report based on the risk that they have or they think they have in terms of their licensure and their credentials, and they're not really making a report based on the risk of future or possible harm on the child. We do need to be clear that reasonable suspicion is not based on the risk of the professional. It is based on the risk of that child. And so that's another thing that we need to really, consider as we're thinking about whether or not we need to make a report. Another thing to consider is that aside from mandated reporting, because researchers have found that mandated reporting laws do not keep children safer. The things that do keep children safer is family engagement and support, service prevention, service provision, and public health strategies that prevent child abuse and neglect. So even though mandated reporting laws are across the country, there has not been any empirically proven data to say that these mandated reporting laws prevent child abuse and neglect. When we're looking at the definitions or the statistics of reporting, looking specifically at general neglect, poverty is a lot of the time being reported as general neglect. So Tuttle et al. Back in 2019 found some interesting research. One of the things that they said is children from households of low socioeconomic status experience some type of maltreatment more than 5 times higher than other children. These children are also 3 times more likely to experience abuse and 7 times more likely to experience neglect. They also found that school counselors are more likely to suspect abuse from children from lower to middle socioeconomic statuses more than based on their race and ethnicity. So this is saying we're looking more, even though there are racial disparities in reporting and in child welfare involvement, which we will get into, the disparities are even more vast from when we're talking about socioeconomic status. So now I'm going to just take us back and walk us through some of America's history of helping the poor. And I put helping in quotation marks, as you'll see, is this truly helping the poor? So child welfare actually began with a story of a young girl named Mary Ellen. Back in 1874, her father was killed in the Civil War, and her mother, Frances, boarded this infant while she worked. Frances subsequently lost her job and was unable to afford her care. Mary Ellen was placed in the care of this woman, Mary, who for several years physically abused and neglected Mary Ellen. There were reports of physical abuse, of locking her in her room, of not feeding her, of not providing her with adequate clothing. She reported that she went many years without even a pair of shoes. Neighbors were outraged, but contacted mission workers, but no one intervened because at that point there were no laws protecting children. So because of that, a mission worker appealed to a man named Henry Berg, and he was the founder and president of the SPCA, so Protection of Animals, and who persuaded a judge to hear the case. The judge heard the case, this child was removed, and there began more reports of abuse and neglect of Child Abuse and the Society for the Prevention of Cruelty to Children was established. So before child welfare existed, there were laws protecting pets and animals, and there were no laws protecting children. 20 years later, there's something that was called the orphan trains began to appear. And as you may know, orphan trains actually moved children of poor families across the country to families who could afford to take care of them and to use them as cheap labor. Before there were orphanages who boasted reforming child behavior and the creation of good citizens, there was this indentured servitude with wealthier families of quote unquote good character, implying that poverty reflects a moral failing of parents and that children were better off with adults of a higher moral character or translated into higher income. Between 1911 and 1933 and the Social Security Act of 1913 provided mothers' pensions and to mothers in poverty. However, Black mothers were excluded from this mother's pension. This really was a foreshadowing. This and other things were really a foreshadowing of these exclusionary practices that supported racial inequities that we still see today. Once we have exclusionary practices that excluded supporting financially all people who were experiencing poverty and only supporting families, white families, then that started to lead to this ripple effect of what we see now when we look at poverty numbers and we see families of color, more families of color suffering from the impact of poverty than white families. It goes on to state that the removals of children is necessary, even though the removals of children is necessary to ensure the child's safety, we cannot negate the fact that family separation exists in a context of historical and racial trauma in America. And so I just wanted to show you, start with this slide. We'll be looking at a couple of slides in terms of what is Alameda County doing? What do the statistics show for Alameda County? So here it's really talking about what we see on the yellow bar is general neglect. And general neglect is slightly higher. It's about 33% of all the reports that we receive. And slightly before that is this physical abuse. So in other counties, what I've seen is that general neglect, that yellow bar, is a lot wider, it's a lot bigger. Here we have about 30% of physical abuse allegations and about 33% of general neglect allegations. Those are the two main or the two most reported allegations by mandated reporters specifically. Another slide that I want to bring to your attention here is how many children we have in Alameda County. So this is year over year. So you can find this on the Child Welfare in California Child Welfare Indicators Project. It is an open, free to the public website, so you can actually see what is not just Alameda County, but all of the counties in the state. What is going on in the world of child welfare. And so if we're looking here about the child population, we had about a decrease in our child population from 2023 to 2024. And if we're looking here about child poverty statistics, we can see where children fall in terms of poverty. So about 30,000 children are reported to live in poverty here in Alameda County. There is this correlation or crossover between child welfare, poverty, and neglect. So Inkowitz and Olson in 2022 found that most reports and subsequent removals allege some form of neglect, and that neglect is correlated with income inequality and poverty. So reports and removals generally come from families who don't have a lot of money. They also found that I kind of mentioned before that children of color come from poorer communities than their white counterparts. Most statutes throughout the state and throughout the country actually prohibit professionals from considering cultural differences when deciding whether to report or not. This is something interesting that I found when I was preparing for this training, because there was this white mother in the New York area. She had a child, and this child was around 9 years old, and that child was found to be taking the subway by themselves. When she was questioned about that, she said, well, I believe in something called free range parenting, where I believe that my child should be in the world and learn how to figure out how to navigate with minimal to no supervision. However, when we see a report of another report that I saw, I read an article recently about this father. He was a Black father, and he had a job interview. This father ended up taking his children. There were 3 children under the age of 10, and he took them to a local McDonald's, and there was a play area there, and he left them there in the play area while he went to go on a job interview. He did not have a childcare at the time, could not afford childcare. That father was subsequently arrested and then released later on, but nonetheless arrested for child neglect, for lack of supervision. So when we're thinking about supervision and lack of supervision, or making decisions about cultural differences, we also need to think about, like, are we coining one person as permissive parenting, as free range parenting, and the other person that may not have the same ethnicity or value system as neglectful? So these statutory omissions really force reporters to rely on our own biases and belief practices, and really from a white middle-class definition of what's quote unquote normative parenting, resulting in an unnecessary involvement or over-representation of families of color in the child welfare system. So we do need to take into consideration, from what lens are we looking at? What are we looking at someone else's cultural parenting practices as they're a non-default? Are we being more curious to families about their reasoning for some of their parenting decisions? So these are some of the things that I hope that we can think about and explore today. Before I get into our next slide, I just wanted to see if anyone wanted to raise their hand or take themselves off mute if they have any questions or concerns before I continue. Yeah, Donna Marie.
Thanks, Colette. I am in a position where I speak with childcare providers who will use me as a sounding board. And I'm really thoughtfully thinking about everything you've presented this morning. When a child has said to the provider, my father hit me, my mom hit me, or when there are markings on the child's body that don't correspond to the story the child tells you. You say, oh my goodness, look at that. What happened to your back? And they say, oh, I was laying on the rug, and it clearly isn't that. Where, I mean, there is a part of me, I've been in the field for 30 years, and I understand that there's a lot of things to think about when the child has clearly told you a story or just straight out said that they have been hit. I guess I'm trying to find the way that I guide people who typically don't want to make that phone call into thinking the process out properly. And I know that we'll probably get there, but that's really what I'm thinking. I'm not thinking so much about something that you might suspect, but when you've actually heard or seen something happen. And I'm just looking forward to, my mind is really heavily set on what happens if you saw it. So in my first year of care, or as a teacher, I saw a grandparent strike a child. And the director forbid me from reporting it because the director said that the child would be worse off in foster care than they would be with their parents. And I know people really struggle, right, with making these calls.
Yeah.
So I don't expect you to have an answer, but I guess that's what's really laying on me while I'm listening to you this morning.
Yeah, thank you for sharing. Yeah, definitely a lot of things to consider. Well, when I hear there are differentiations from um, um, physical discipline of parents and child abuse. Or physical abuse specifically. So, when I hear you saying, oh, well, I saw a grandparent like hit a kid and my director said, don't report. Well, yes, there are foster care that we will get into has some really negative impacts on children and families and communities. Um, and there are various other options that, I work with families about in terms of how can I educate them, how can I show some empathy around, like, if I see a grandparent hitting a kid and it's not to the level of physical abuse, how can I provide them with some empathy around, oh, wow, this, parenting is difficult, things are frustrating, like what can I do to support you? What do you feel like you need, if anything? And going it more of a joining empathetic way. So that's one thing. And when I hear about children having bruises on their back, generally, when we think about child injuries, we think about child abuse indicators, and one of those indicators is a location of injury. And you're right, most of the time, children who are active and playing generally do not have marks and bruises on their back. Like, that's not generally a place where children bump and hit themselves. And we will talk about, so when things are clear to report, yeah, people are worried about reporting because they say, well, CPS is not going to do anything. It's going to be worse for the kid. What if they don't even come out? However, there is this threshold of that we are mandated to report. So some things we don't have leeway in making reports on. With things like bruising on backs, if like the story doesn't match up with the bruises, then we don't have any leeway to be like, oh, let's not make a report. I think the real rub is, how can we determine like where do we have leeway? Because a lot of times we may feel like we don't have leeway when in actuality we do. So that's the thing that I'm really trying to, that I hope that we can all get out from this is if we are making a report, or if we're not making a report, how can we still engage and support families in a way that is still helpful? Because we do need to kind of have a shift in mindset about like seeing something and then making a report without engaging in families. I think we get scared to engage in families and ask them about what's going on. That doesn't, engaging with families does not preclude us from making a report or not. But a lot of times people may see a situation, they're like, well, I don't know the parent, or I'm not engaged with the parent. Well, that may be the time to do so. I really support mandated reporters and our community supporters into really establishing relationships with families from the beginning of our time with them. So that way, if something does come up, we can engage in supportive services. It is important for us as community supporters to know the supportive services within our community, to have those things readily available, to even talk to parents about our role as mandated reporters as we interact with them, beginning to interact with them, and to provide parent education around discipline practices. Because a lot of times our families are, like, a lot of parents are stressed, upset, and have a lot of other things going on, or they may be completely ignorant to like what is abuse or neglect. I hope I answered some of your questions.
Thanks, Colette.
Okay, thank you. All right, so as we continue, because we found throughout the state that throughout the country, that the real negative impact of mandated reporting and the negative impact of engagement with child welfare, something came to pass in 2018 called the Family First Prevention Services Act, or the FFPSA. So prior to the FFPSA, child welfare agencies were actually given federal dollars for each child in care. So it was actually an incentive. It was an incentive for child welfare agencies to have children in care, because that's where they got most of their money. So you saw like in the 70s, 80s, even 90s forward, you saw a lot of children in child welfare, because again, that was how funding was established. They said, how many children do you have in care? Okay, well then we'll give you dollar for dollar based on that. But unfortunately, this had some definitely negative impacts on family, on society. And so they passed these provisions to say that actually, instead of taking children out of the home, we're actually going to start to pay for or provide provisions to enhance supportive services for families so they can remain safely in their home. It is far better to support families in parent education, basic needs support, social connections to help children remain safely in their home. This actually reduces the unnecessary use of congregate care. A lot of children, especially teenagers, ended up being in group homes and other agencies as opposed to residing with their families or with their extended family members. It also had a built-in capacity for communities as a whole to support children and families. The Families First Prevention Services Act also established and enabled states and territories to use funding for prevention services, including evidence-based mental health programs, substance abuse treatment and prevention, in-home parent and skill-based programs, and providing kinship support. So again, really focusing and shifting the funding to provide families with the care and the support, because prior to this, states and the federal government was providing funding to foster parents, to group home organizations, instead of providing funding to families. So that this was a shift in funding to say, like, well, if we're paying foster parents and group home organizations for education around parenting, providing them with wraparound services, far better to provide these to the families themselves. Because as we know, there are parents who continue to have children. And so it makes sense that the shift happened from not providing them supportive services to providing them services within their home. When the FFPSA was passed in 2018, the federal government offered every state in the union an opportunity to receive this funding. Most states opted in. California opted into this funding and this federal funding, and that kind of shifted California's intervention lens towards prevention, and then established the Family First Prevention Services Program of 2021. You all can actually look at, you will get a copy of these slides, and if you click on the list of county prevention plans, you can actually see all 58 county prevention plans that were established so that the counties can receive the state and federal money towards prevention services. Alameda County's prevention plan. Alameda County has been really on the forefront of prevention services. So Alameda County was doing prevention before it was popular. So before the FFPSA, Alameda County was engaged in something called the Title IV waiver. And I believe the waiver occurred back in 2022 to 2027, 2002 to 2007. So a long time ago, as compared to now. And what they did, they were really looking to already reduce the number of children entering foster care. So what the waiver did, instead of receiving money per child in care, Alameda County and actually LA County received a block sum of money. And that block sum of money, they said, okay, well, instead of putting the state telling you to put this money into particular boxes, they basically said, actually, we'll give you this block sum of money and you decide what you're going to do with it. So, so when Alameda County received this Title IV waiver money, they looked to reduce the number of children entering foster care. They also looked to increase the availability, which they did. of early intervention strategies. They increased placement in relative homes and reduced congregate care placement. They went from something like 3,000 children in care, and they really reduced that number to all the way to about 800 during that 5-year waiver. They were also increased the percentage of safe reunification, which reduced reentry, because that's also one of the indicators that the California Child Welfare Indicators Project looked at. They looked at when children were reunified in the home, were they harmed again? Did they re-enter into the child welfare system? So by increasing safe reunification, that also reduced the number of children who returned to the child welfare system. And this had very successful outcomes and positive changes that we see today. So the Alameda County's County Prevention Plan really was in coordination with the Child Abuse Prevention Council, with community members, with probation and mental health, all came together to say, like, how can we work as a whole, as all these huge organizations within Alameda County, to really work together to support families. With the Child Abuse Prevention Council, or the CAPC, they started something in 2020, I believe, called the Strong Families Alliance. These are organizations who actually receive child abuse prevention funding, and they work in concert with the community to uplift the protective factors. And they really collaborate on best practices for safe children in healthier families. One of the things the CAPC does is coordinates with a lot of organizations to really uplift those protective factors. There's funding specifically used for that purpose, for the purpose of providing basic needs, actually money in the hands of children or families with children, so that they can reduce the need for engagement in the child welfare system. Alameda County also has something that's ongoing right now called the Equity and Inclusion Fellowship. Now, this fellowship began in 2016. So if we're looking at when the FFPSA started, which was in 2018, these things that Alameda County has been doing actually predates the federal and state government around supporting prevention. This Equity and Inclusion Fellowship worked specifically, included child welfare staff and their leadership, so not just child welfare workers, but their supervisors, program managers, all the way up to the agency assistant director. And it really causes to identify organizational and interpersonal behaviors that perpetrate oppression, inclusion, and continued disparities in child welfare. When we look at our work with families, a lot of times we externalize what we're looking at. We say, well, this person is the problem, or this is a problem situation. Well, with this Equity and Inclusion Fellowship, they really were like, well, actually, there may be laws and procedures in place, but how are we interpreting those laws and procedures? How are we operationalizing those procedures? So it's really about looking at the organizational behaviors, because sometimes we may need to look at our policies and procedures within our organizations that perpetrate racism, that perpetrate penalizing poverty. So this really talked about not only where our personal views stem from in terms of our own belief systems and values of how to raise children. We may say, well, I wasn't raised that way, so that way another person is raising their child must be wrong, or vice versa. So we do need to really consider what lens are we looking at to making these decisions. And this fellowship also supported child welfare staff in learning the historical context of race and racism and its implication for child welfare practice. There was one time that I was conducting a training for interns of their child welfare interns. And I asked them one of the questions before we talked about neglect, and I asked them, does neglect equal poverty? And actually about half of the room said yes, that poverty is neglect. And so we do need to have this we need to have this shift of mindset in terms of actually poverty is not neglect, because poverty is not willful. And so where general neglect or severe neglect is. So the main things that we see in Alameda County's prevention plan is the usage of motivational interviewing, really going at the heart of when we're working with families, what motivates them to change? How can we help them articulate or get them to articulate what motivates them for positive change? It's less about the professional saying, well, you need to do this, you need to engage in this service, but actually seeing like, well, what motivates you? What inspires you? What do you, and what are some of the barriers that may prevent you from meeting your goals? Really highlighting and supporting the protective factors, building on what's working, really talking about and working with families about, well, what is working well for you and your family? And what are the services and supports that you already have in place? And how can I support and may I support in enhancing those things? Alameda County also uses the gathering place, and the gathering place is a place that provides therapeutic visits for children who are in the foster care system, so that when parents and caregivers are in the process of reunifying, they have a therapeutic place that they can go and visit with their children with supportive services. The gathering place even has like a kitchen where parents can cook meals with their children in a safe environment. Alameda County also engages in something called Another Road to Safety, which is their differential response program. And that differential response program is a program where, previously before this summer, actually, if a child welfare, if someone made a mandated report to child welfare and it didn't rise to the level of an investigation, that supervisor on the hotline can refer them to a community-based organization where they're offered voluntary supportive services. This has been expanded with the county prevention plan to also include families who are not called in on the hotline. They have actually created something called a community pathway. A community pathway is so that families do not need a child welfare call to receive these services. And if you're interested in finding out about that, and I'll actually put it in the chat for you all. It's through A Better Way. And if you look on Road to Safety Community Pathway. This is something that all people can refer families to. Right, they provide about 6 to 9 months of case management services, and you do not need to have a report to child welfare to engage in these services. And also, the County Prevention Plan for Alameda County has something included called Family Reclaim. And Family Reclaim is another supportive organization or supportive program that provides services and supports to children who live with their families, with their caregivers, but they are under the umbrella of the child welfare system, meaning that they have been determined that they have been either abused or neglected. However, they remain in the home. Not all children who have been victims of abuse and neglect are removed. And so this is, again, another push for providing supportive services to families within their home. There has been a paradigm shift. Yes, it is definitely penalizing poverty is something that we definitely need to talk to judges and lawmakers about. So I'm definitely in talks with different community organizations that specifically to lawyers to really talk about how can we shift from poverty versus neglect. So there's some, again, some research that has been found that children are being reported and removed from their primary caregivers at alarming and increasing rates, especially for families and children of color. Again, it talks about the emissions of poverty, not just culture, but emissions of poverty and cultural considerations leads to the continual explicit and implicit racism in the child protection system, beginning here with reporting. This paradigm shift shifts really what we know as reportable neglect. This shift is really talking about how can we like redefine, and there has been some redefinitions of what is reportable. We do need to think about like our own biases when we see children and families suffering from poverty. A lot of times when we're looking at, and I just want you to like take some time and really think about if you've had to make a report of possible abuse and neglect before. And if one of those reports that you've made or considered making had to do with someone experiencing poverty. Just kind of think about that for a second. And then ask yourself, was this willful? Was this person who may not have had adequate clothing for their child or children? They may not have adequate supervision for their children. They may be unhoused. You may see children who don't have very good school attendance, and we're wondering why they're not in school. They may be taking care of other children, younger children, or younger siblings due to their parents' inability to provide some adequate childcare. We also need to reconsider what we think of as poverty. Poverty is not a moral failing of parents, and a lot of times we may not consciously think of that, but a lot of times that's how it translates into our reporting practices. Poverty is not intentional and it's not willful. General neglect, as defined by state law, is intentional it's willful. General neglect or even severe neglect means that a parent or a caregiver has the ability to provide food, clothing, shelter, supervision to that child, but they refuse to do so. Like when we're talking about the case of Mary Ellen, Mary, the person that adopted her, had the ability to provide her with care, supervision, clothing, shoes, but she refused, she was intentionally refusing to do so. And again, research proves that there's no connection between mandated reporting and maltreatment prevention. To that end, general neglect has been updated. I know when I was a budding social worker, when I took my first mandated reporting class or training, I assumed, like maybe many of us assumed, that once you got your mandated reporter training at the beginning of your career or the beginning of your employment, you were all done. It was a one and done situation. However, that's not the case. There have been times that when I've talked to mandated reporters, community supporters, and I talk to them, I'm like, oh, well, about the need or the desire to have a mandated reporter training. And they say, oh, I've been in the field for X amount of years. I've taken my mandated reporter training classes. Now, while some of the indicators of physical abuse may not have changed, the definitions of abuse and neglect, our responsibilities to the community have changed and do change over time. So it is important to have continual training, updated training around mandated reporting so that we know that we're still operating in alignment with state and federal laws. To that end, Assembly Bill 2085, it was passed in September of 2022, and it became in effect beginning of January of 2023, and it updated California's laws around general neglect specifically. So what it says is it's that general neglect means a negligent failure of a person having care or custody of a child to provide adequate food, clothing, shelter, medical care, or supervision where no physical injury to the child has occurred, but the child is at substantial risk of suffering serious physical harm or neglect. So I want to take a moment to kind of like sit back with that, because we're talking here about general neglect. And a lot of times, most of the times when the child abuse hotline is receiving reports of general neglect, a lot of it is the impact of poverty. And so then we don't investigate. And then if we don't investigate that, if there's no investigation, that family still has built-in child welfare history. Child welfare history does not go away. Once a call has been made, that history stays in the reports stay on that family's and specifically the birth mother's file. And that history never goes away. So when we're looking at the definition of general neglect, I want to point out some things as we break down this definition. The first thing that I want to point out is that it means a negligent failure of a person. So when we're talking about negligent here, we're talking about a person who is willfully not providing care for that child. It says, and it also goes on to say that it's not including someone it's including someone or a situation where there has been no physical injury. So you don't need to have a physical injury to a child to report general neglect. However, They make this definition, they added this definition or clarified, but the child is at substantial risk of suffering serious physical harm or illness. So that's the piece that, one of the pieces that has been updated. So again, if we're looking back and thinking about if we've had situations where we needed, or where we reported or felt like we needed to report allegations of general neglect, it's it did not have this definition of substantial risk of suffering serious physical harm or illness. So that means we're not to make a report of general neglect if this child is not at substantial risk of suffering serious physical harm or illness. So what are some of those possibilities? Some possibilities could include a child not going to school. It could be a child of a certain age coming home from school when their parent is not there. It could even mean an older sibling taking care of a younger sibling. It could mean that a child is hungry. They come to school hungry. I know there was this one report, this one investigation where a teacher made a report on a child because the child had holes in their shoes. Their clothes looked a little small on them. And it was reported that the child also had a specific odor to them. This teacher used to send the child out into the office because of their smell. They would try to, when they engaged with the parent, they said that, or attempted to engage with the parent, it was a mother, that it was reported that the parent wouldn't make themselves available for phone calls. And that they said that the parent, when they would drop the kid off, that the parent was put together with like makeup and the hair nice and, accessories, but the child was looking really dirty and dingy, for lack of better words. An investigation did occur. And once that investigation occurred, the investigator found that the parent had a job where they weren't supposed to be, or were disallowed from receiving phone calls during their work shift. So there was this, what was perceived of a lack of engagement or lack of care, really had to do with like the parent unable to receive phone calls while they're working. And so we may have these perceptions that parents are unavailable or not, or lacking care for their child, and not really thinking about or having an understanding of that parent's work situation. The investigator also found out that it was this parents' culture that children have like play clothes, and that these children, that they wouldn't send their kids to school with really nice clothing, that they would only send a child to school with clothing that were tattered, that were older, because the kid like played and was really rough on their clothes. So they specifically put their children in those clothes because they would be playing all day. Again, something that the reporter had no awareness of. And when we talked about the child's odor, the first thing that was asked, or one of the things that was asked was about the impact of that odor to like that child's mental health, emotional health, or even with other students. Because if that student was impacted by like bullying, or was isolated because maybe other children were offended or made fun of that child for that smell, then that's something that we could talk to the parent about. However, when we're talking to the reporter, There were no indicators that that child was being bullied by other children or had a lack of friends and playmates. And so really it was the odor that was bothering the reporter. So that child was penalized by being sent to the class, to the principal's office or to the office. They were kind of excluded from being with their classmates. And when the investigator talked to the parent about this odor, because when child welfare staff do investigations, one of the investigations is that they must go to and to do home visits within the home. They noticed that the home did have a smell, not an odor. It was not an odor of rotten food or dirt. It was a smell of like this family's culture's food. Like their food smelled a certain way. So their home smelled a certain way. And then that child smelled a certain way. We can kind of think about this if we're thinking about it in terms of like cigarette smoke, where if there's cigarette smoke in the home, then that'll be within the home environment. And then we may have children smelling like cigarette smoke. So, or even marijuana smoke. So this was a food odor that was, or food smell that was not pleasing to the mandated reporter. So we do need to like take these into consideration and be more curious with families and parents. And if you say, well, I don't know this parent and I didn't engage with them, well, this is an opportunity as we're working with people to become engaged with them as we begin our relationship with their children. This Assembly Bill 2085 also went on to state specifically that general neglect does not include a parent's economic disadvantage. So this means that this goes from our first suspicion or our first discomfort to asking a couple of more questions. It is specifically stated in the law that we are to only make reports that do not include a parent's economic disposition or disadvantage. So that means we are required to engage with families more. We are required by state law to ask and ask families, ask ourselves and ask families, is this report based on poverty or the impact of poverty? Or is this a negligent failure of a parent? And does that negligent failure lead to a substantial risk of serious physical harm or illness? And when they say serious physical harm or illness, that means, does that report lead to a situation or could lead to a situation where that child must be maybe hospitalized or needing some medical care? So that's really the definition of serious physical harm or illness. Like, do they need medical intervention because of that inaction of that parent? So when we're thinking about people who that child that I just mentioned, none of those things would point to that child being at risk of suffering serious physical harm or illness, so that in actuality did not need to be a report, was not a required report. This paradigm shift of moving from poverty to neglect, some more research that I'll share with you, and we kind of talked about this already. Children of color who live in poverty at disproportionate rates are overrepresented in the child welfare system. Nationally speaking, of all children who have received an agency response, that means an investigation, 60% of those children experience neglect and no other forms of maltreatment. and where we see in very notable cases of child abuse that are perpetrated generally by organizations or white caregivers. So what that means to say is when we've heard very salacious, noteworthy, newsworthy cases of child abuse, generally it is not neglect. Generally it's sexual abuse or physical abuse. Generally those reports are perpetrated by organizations like in foster homes or by white caregivers. So when a lot of times we may have this view of like, okay, well, children of color, they must be harmed more. When in actuality, most of the harm are not perpetrated by families of color, and most of the time, those families of color are impacted by poverty. So we do need to think about like how can we look at our implicit and explicit bias? So when we're engaging with families, there are some things that we need to really think about, consider for ourselves. We need to ask ourselves, how should I respond to families impacted by poverty? Is this a mandated report to child welfare? Child welfare does not provide supportive services for children and families impacted by poverty. Child welfare is in place to support families and protect children impacted by abuse or neglect. That is a difference. We also need to ask ourselves, am I thinking of making a report based on cultural, parenting, or other socioeconomic differences? We need to ask ourselves, is there a risk of imminent risk of harm? A lot of times when we're making reports specifically for general neglect, we may not have reached that threshold of imminent risk of harm. Another thing to ask ourselves is, am I making this report based on my liability? Making a report based on liability is not the essence of the law, nor is the basis of reasonable suspicion. Nowhere in reasonable suspicion does it say that you should make a report to protect your license. You should make a report to protect your credential. It says reasonable suspicion is based on the facts that you believe that a child is at risk who has suffered or may suffer from physical abuse or neglect, or these other categories of abuse or neglect. The California is going through a reform. Is going through a reform to talk specifically about removing the liability clause of mandated reporting, because we've seen it have unintended consequences. So many people say that, oh, I don't want to lose my license, so I'm going to file this report. So there is some talks at the state level there about removing that liability clause. So there's a question here about emotional abuse. So it says here about that emotional abuse is not a mandatory report, which is true, but it can be deeply harmful, and that judges and lawmakers are still behind. So yes, you're correct that emotional abuse is not a required report. It's not a required report to child welfare and law enforcement, and it is deeply harmful. But I do want to say, just because we have situations that are not a mandated report, that doesn't stop us from supporting families. That doesn't stop us from engaging with parents and caregivers around whatever those harmful behaviors are. Emotional abuse specifically could be from parents being at their wits' end, not understanding child development, not understanding or having other tools in their toolkit to for some education around parenting. So yes, it is deeply harmful, and I'm wondering, how can we engage with families? How can we engage with parents and caregivers in a way that is supportive, that is inviting? How can we be more curious and seek to understand like their own possible traumas around parenting or around their own childhood that may impact their ability to engage in a different way with their child. So there was one colleague who has really supported my growth and development over time. And she said something like, dysfunction does not equal abuse or neglect. So we do need to see things as a spectrum. We're not saying do not engage and support families when there is dysfunction, but we do need to be clear, like, where does dysfunction end and abuse, specifically emotional abuse, start? Where and at what point can we engage with families around different parenting practices? And I say at all points, from general services to having outings with families, giving them resources and supportive phone numbers and referrals to things within their own community. Because a lot of times parents may feel isolated, may feel judged. A lot of parents feel judged in their own parenting practices, which prevent them from wanting to engage or be open with mandated reporters. But if, as mandated reporters, we provide and support all families and all parents in a way that's engaging, non-judgmental, and curious, then they're more likely to accept our supportive services when we offer it to them. So we do need to consider and look at what other options of support are available. Yes, Ashley, thank you for talking about these Mongolian blue spots. They're that's a really good point about Mongolian blue spots. Actually, my second child, my younger child, was born with those. And I remember going, and I've been in child welfare even prior to me being a parent. I also have a 22-year-old, a 22 and 17-year-old. And I remember taking my younger child to healthy child visits. And every time they like looked at my child and rolled her over on her back, she had these spots on her back and her buttocks. And I would be like, please check her chart. You can see that, she was born with these and that, they marked it. And as a child welfare professional, I was still having a lot of like trepidation and worry every time I took my child to the doctor, because I was like, are they going to think that these are bruises? What if they don't believe me? And a lot of times, not always, people are believed. A lot of times, specifically when we're looking at that, perceptions of parents, we look at parents in the eyes of, are parents sad? Are they mad? Are they bad? Like, we may not be looking at the actual evaluation of facts that we see, but we do we have this idea that when we look at a parent, we're like, oh, they're really sad, and we may not make a report. They may present as someone who is sad, who's crying, but then we see the facts that may lead to, oh, this looks abusive, but they're presenting in a different way, as opposed to a parent who may be presenting as mad. They may be mad about the way that you're asking questions. They could be mad about how the system and how their perception of how the system treats them and how they are received by service people. So they may come across as being quote unquote mad, or they may just be in their personality to be loud and not very animated. So we may be like, oh, we need to report them because they are mad. Or we may look at certain families and say, like, you know what, those are bad people. And so we need to really think about our own perceptions and biases around, are we looking at these caregivers as sad, mad, or bad? And does that impact my ability to engage with them? Does that impact my ability to support them or report them? So we do need to, or not report them. So we definitely need to continue to consider this, how building a relationship with families is the best way to provide supportive services to families. And studies show that engaging and having a relationship with caregivers actually reduces the number of suspected child abuse reports. In alignment with supporting families, there is Assembly Bill 1719. And again, this is another new law. This just happened in August of 2024. So again, this re-emphasizes the importance and my stance of having continual updated mandated reporter trainings. It is not a one and done thing. We need to continually be aware and have these opportunities for dialogue with each other, with our trained professionals around suspected child abuse reporting. So Assembly Bill 1719, established in 2024 in August, says that it is no longer a required report. It is no longer a required report to CPS for general neglect. We are no longer mandated by state law to report general neglect. This is only, that doesn't mean that you cannot report it, but this falls into the category of like emotional abuse. It is a may report, not a required report. So what does this mean? Like what happened? So what it says is that mandated reporters now can report to community-based organizations. You can report to community-based organizations that you believe that can provide supportive services that ameliorates the conditions impacting the parents or caregivers' ability to provide food, clothing, medical care, or supervision. This law goes on to state that you can do this instead of or in addition to a CPS report or a report to child welfare. So what does this mean? This really, really further highlights the AB 2085 law, redefining or clarifying the definition of abuse and neglect. And then when it says that general neglect does not include a parent's economic disadvantage, this fills in that gap to say like, okay, well, if I'm not reporting, then what do I do? This means that instead of filing a suspected child abuse report, or in addition to filing a suspected child abuse report, then you can refer them to a community-based organization. This does mean this now has a built-in, I need to talk to these parents. I need to engage with them, because there is a point in time where we need to say like, or we need to gather enough facts to say that this is a suspected child abuse report. This new law does not include severe neglect. This does not include other abuse categories. This also means that we are really shifting our view and our role from just a mandated reporter where we're providing this strong level of surveillance and quote unquote oversight to families, where we're really engaging with not just families, but community organizations. So when these laws came to pass, I was like, oh, this means that mandated reporters are really turning into social workers. We're turning into social workers in terms of having the requirement to know what community support services are in our area. That means that the onus is on us to be like, well, this is where I know to get to refer families for adequate childcare. These are some food pantries for people suffering from the impact of poverty and not being able to afford food. This is where I can refer my families to go if they need some clothing or supportive or shoes for their children, where they can go for help for concrete supports in times of need. If there are families who you may be have gone to do a home visit, and maybe that parent doesn't have electricity. Maybe you see what I used to see as a child abuse investigator and families who are really impacted by poverty is an extension cord from their home to maybe a neighbor's home, where that neighbor has allowed them to utilize, some portions of electricity because they weren't able to pay their PG&E bill. Or they would use their neighbor's like shower or bathroom, or throw water in the toilet to flush it because they weren't able to afford to pay their water bill. Or even in situations where children don't go to school because that parent may have a car that's no longer working and they're unable to get their kid to school. So this really speaks to the heart of supporting families where they are. It is we have healthier communities when we are supporting families to keep their children safely in their home versus paying foster care or group homes to watch children. And if you all are coming back to the impact after reporting, we'll be talking a lot about the impact of child abuse reporting on families and relationships. So when we're talking about engaging with families, there's some more things that we need to consider, and I kind of mentioned them already. Having relationships with caregivers reduce the need to file a report. Time over time, year after year, research has found that if caregivers, if our mandated reporters, our community supporters have relationships with caregivers, that means we have a better understanding of their background, their parenting practices. We may have some indication on if they're struggling financially or with mental health struggles or other family dysfunction issues, that we can provide supportive services to them or provide them, maybe not directly, we may provide a referral to a community supportive services. Engaging with families knows that these updated laws, it means that we have to know community supports. We do need to work collaboratively across differences. And then I like to ask the question, instead of penalizing poverty, we need to ask the question, can money or resources fix this concern? As a child welfare professional, and a therapist in my community. I look at that a lot in terms of there are a lot of abuse or neglect issues that cannot be fixed with money. If we look at a lot of concerns that we've come across, many of those things you cannot fix with money. But you cannot fix sexual abuse or address sexual abuse or address physical abuse or even emotional abuse most of the time by giving a family money. However, when we're looking at general neglect, and if we talk about that child who may not have adequate clothing, or that child who comes to school hungry every day, or that child who goes home to an empty house because that parent is at work or works various hours and they don't have adequate childcare. If money or resources can fix this concern, most likely, more oftentimes than not, it is not a mandated report and it's about poverty. And so we need to provide families with supportive services and refrain from being judgmental. We do also need to remember that parents and caregivers are the experts of their families. And it's really about asking how you can support them. We need to, also not utilize our professional position to say that we know better. We may be there may be times that we have more education, have more knowledge around certain things, and knowledge is power. How can we support families and parents to obtain the same knowledge that we may have? That especially parents who are dealing with possible emotional abuse, or we think that it's some emotional abuse going on. Sometimes parents are unaware that those behaviors are emotionally abusive. Sometimes parents may not know that withholding affection could be deemed as an emotionally abusive behavior. Some people may think, oh no, I don't want to spoil my child. And so that's why I'm engaging in this type of, if they're crying, don't pick them up. But it could be that they're just unclear, unaware about those impacts of like attachment and bonding. So we do have a lot of opportunities to engage and work with families on that level. I like to end with this slide because a lot of times, definitely in my previous experiences, children will come to school inadequately dressed for the weather. We may have children where it's December, it's raining, and they have on sandals and shorts. And we have, and sometimes parents are penalized for that, as opposed to reaching out and saying, actually, my child does have a jacket. They just don't want to wear it right now. But we need to shift our mindset when we look at situations and families, not to just what we see and not just what we feel, but we need to question those facts. We need to make sure we have facts in place before we make a report. We need to engage with families and be curious with them to see if they need support, because sometimes we may think a child doesn't have a coat, because they don't have one, but the parent's like, actually that child has a lot of coats, but they just refuse to wear it. So with that, I'll take any questions or comments. I'll open it up to everyone.
I just want to share one in regard of, be involved with families. I think I have a concern more from the moral aspect. about the situation of, in general, especially emotional abuse, and can be, it's like the bullying situation today, you know, in that area or gray area. And of course, we have to consider many things: the cultural background, understanding a lot the family, where they come from, and of course, especially in those cases that are not mandated reported, you know, how to work with those families. That we, you know, when especially our different cultural differences that have different value belief systems, that can be really complex. In regard, for example, coming from countries that their hitting is acceptable, is part of the obeying without questioning, is part of the moral belief or religious belief, versus questioning, having more open-ending questions, reflecting together, that, you know, in other cultures, no. So we, you know, as in mental health, also we do psychoeducation, right, many times about what is, one thing is where they come from, and another is the, as an immigrant, how they adapt to this society, and how we provide education as well about what is expected as part of the social amalgama to what can be or be more adaptable, adjustable to the system and the belief system. And I mean, it's totally different from what people come from. So that takes time. Takes time adjusting and more tools. And of course, certain organizations, maybe like you mentioned before, maybe provide that as a solution before, like the mandated report, or, you know, that is more extreme, without saying, no, it's like kind of blaming someone without having enough knowledge, versus doing the prevention. And by educating, by, you know, I think that is huge, the impact that I think ongoing, I see in the near present or near future as something positive in this regard of change. But like I said, I probably there are more research to be done, even under the law also, what happened, how affect mental health the law as well. In some moment can create more damage than solutions, is my concern as well. And it's something, I leave it open to ongoing discussion because we don't have time, but it's not something minor to consider. This beyond the poverty and the financial discrimination that is beyond different ethnicities. You know, there's something is happening already. That is also part of the concern. But I think one of the things that resonate the most is that part of poverty versus neglecting, and also the moral aspect. For example, the parents say, I want to raise my kid to independent, because this, I think the big question to me is, what kind of kid, what kind of men we want in this society? What is the shape, the cultural shape we expect? You know, and that is for me a quick question as a background in education, in mental health, is what kind of men we want? And that have different interpretations, views, and judgments. What is right in regards of the moral aspect, what is right, what is wrong. And on the top of that, having judges that are above us, that put a lot of pressure in mental health department that I don't think sometimes is adequate. I think that will be for me. And they can create more harm again than solutions to us in this field that will really harm many people, really want to see the well-being in our communities and everything. And unfortunately, with narrow-minded mentality, sometimes they don't have openness to really understand more the human being necessities and how we really create well-being, and the moral aspect that is imposed versus is an open dialogue to help this human being to develop more freely in a free society. Okay, that's something to share. That's it.
Yeah, no, thank you. You said, I couldn't have said it better. And yeah, we do need to, I do like the idea of, like, as families, as newcomers, come into our purview and come into supportive services. How can we do, it is our responsibility to be like, okay, I understand this is when you came from, this is how discipline happens there. And some of these behaviors can get you caught up with the law here. And so how can we have these supportive conversations, these informative conversations with newcomer families. So, and not just see them doing something, be like, oh my gosh, you're abusive, you're neglectful. A lot of our work with our, with the people that we work with is around that education piece and in a non-judgmental way. So I love that. Thank you so much for sharing. We're almost done with time. Are there any lasting or any more questions or comments that anyone would like to make before I turn it back over? Catherine?
Okay, just taking a look at the chat if there's any questions or any hands raised. Okay, well, I just want to take a moment to say thank you, Colette, for such a wonderful presentation. As always, engaging conversations. And we look forward to seeing everyone in our next session. And you're welcome to register for that. And then a friendly reminder for post-training evaluation. So we do appreciate the feedback. So thank you all, and we'll see you next time.
Thank you so much for having me. Thank you.